So I am here at the Avera Cancer Institute Navigation Center, and I'm here with Jamie, and she's going to give us a fabulous tour, and she's also going to tell us why Avera Cancer Institute is different from all the other cancer institutes in the country. So go for it.
Okay.
We will follow you.
Well, I'm glad you're here. We actually are really trying to promote our new service. We just here at the Avera Cancer Institute in Sioux Falls, along with our 5 other Avera Cancer Institute locations. We actually have 6 across the state of South Dakota and into Minnesota. Collaboratively, all 6 of them came together and we talked about providing navigation services to anyone affected by cancer. We've had a very robust navigation program here at our Sioux Falls Avera Cancer Institute, and navigation services are so beneficial. We've had a lot of great outcomes for people and their family who have had a navigator involved. And so we decided, how do we provide that to everybody, not just people that come to one of our locations or have a certain diagnosis. So hence the Navigation Center was born. We live in a very, very rural area here. And so if you think about where we're at, I think 63% of our patients actually travel greater than 100 miles to come here for their care.
Oh,
so
wow.
You have a sense of how rural we are. And if you think about the rural nature of this area, you think, how do I help people, anybody? It doesn't matter where you live, doesn't matter if you're a patient, doesn't matter if you're a family member, caregiver, medical professional, doesn't matter if you use our healthcare system or you utilize another healthcare system. We want to be available to you. So we set ourselves up really as a call center. And so if you look back here, we have our full-time navigators who are currently behind that wall taking calls. And then we have 3 additional workspaces that fill intermittently with navigators. We have social work and nurse navigators that work here. So they are oncology, they live in the world of oncology, so when somebody calls them, they can trust that they're getting the psychosocial support or clinical support from somebody trained in oncology, which is wonderful.
Nice.
And so that's where the navigators are housed. My office is right over here, so I'm right here in the space that the navigation happens. Dorinda's at the front desk. She does a lot of our coordination.
Are you scared of the camera?
No.
This is Dorinda.
So Dorinda is the beautiful face that greets folks as they would walk in, because we do have people that we serve who walk in and physically meet with navigators. And if they do come in and physically meet with one of our navigators, we have a family conferencing room, which is right here. So the navigators could sit down with them and visit with them in person, just as
Nice.
they would if they were to call in. They would be able to provide the service over the phone. Like I said, being very rural, we wanted to be providing a telephone service so we had ourselves accessible to anybody.
Right.
So
That's
yeah.
amazing.
Yeah.